If your child has a droopy eyelid, that is often called a ptosis. They can be born with it, or you can notice it shortly after they're born. Because when they're first born, they spend a lot of their time sleeping and the eyes don't fully open. But it's not uncommon that you will come to see me with your child aged 3 weeks old who has one eyelid that is drooping and it's interfering with the vision. In that case, you will probably be very worried about your child, and you'll need to see a pediatric ophthalmologist and a pediatric oculoplastic surgeon, or an oculoplastic surgeon who is interested and has a lot of experience in looking after babies who have droopy eyelids. It's a worrying time for you, and it's a worrying time for the child, even though they don't realize it, because their visual development is so important. One of the problems you'll see with your child, particularly if they have both upper eyelids that are droopy under the age of about 3 or 4 years old, is that it affects their head position. And so they tend to go around with their chin up, and if they're still at crawling age, it can really cause them quite a neck ache. And so we're very keen to be able to do droopy eyelid surgery, ptosis surgery on your child, not just to help their vision, but to help their posture, and to help again their interaction with other children. And we also at the same time have to check that they don't need glasses should they be long-sighted or short-sighted, which sometimes coincides with droopy eyelids. So with a child with droopy eyelid, our main priority is to make sure your child can see well, and if they can't, we do all we can to lift the eyelid, check the vision, give them glasses, do any patching as is required so that both eyes develop well. If the eyelid is not going to be cleared off the visual axis, I will have to go in and do a very small operation on your child's eyelid to lift it, just with a little stitch that helps it to go up a bit higher so that they can see out. And together with a pediatric ophthalmologist, we'll see whether your child needs glasses and give them the best possible vision so that they can interact with other children and so that they can see well. If your child has upper eyelid droopiness or droopy eyelids from ptosis, and it's not interfering with their vision, but we know that they're going to need to have something done about it because they're going to go to school, we usually elect with yourselves to do the surgery around about age 4. This means that once they're in school, their eyelids will be in the right position. This will help their confidence enormously. They won't get teased at school. They will feel just like all the other children.